Hi, welcome to Willow Wellness Clinic. I'm naturopathic Dr. Cecilia DiMartino, and today I'm going to be talking to you about the thyroid hormone and thyroid hormone testing. I made a little drawing here to kind of hopefully explain things a little bit easier and hopefully it makes sense. Basically, your family doctor, if you go and ask for thyroid testing, generally speaking, they will test this hormone right here, TSH. Thyroid stimulating hormone. Thyroid stimulating hormone, as the name says, it stimulates the thyroid to function. So the brain sends a signal called TSH and it causes the thyroid, which is located in your neck, to function. The thyroid is important for our metabolism, for heat, for energy consumption, for feeling energetic. So if your thyroid is not working optimally and is working suboptimally, you may be feeling sluggish, maybe you have some constipation, maybe you can't lose weight. Those are all things or clues to say, you know what, let's make sure your thyroid is working properly. Your TSH is often the first thing that gets tested, and the range can be up to 4, some labs up to 5. However, you really want to be between 1 and 2, ideally. So even if you are optimal in that range, we also do want to make sure that the thyroid hormone itself is making enough thyroid hormone. So the thyroid gland here in the throat makes an inactive thyroid hormone called T4. T4 then gets converted into the active thyroid hormone, which is T3. It can, though, also be converted into the T3 blocking hormone called reverse T3. And so a more thorough thyroid panel would involve measuring TSH, T3 and T4, reverse T3, and also antibodies. We want to make sure that your body is not attacking the thyroid hormone, which is quite common actually. So even if your TSH levels are normal or in the normal range, I do want to make sure that everything else is also normal and ideally even optimal. Because I have seen patients whose TSH are great, but yet when we look downstream, especially at the active thyroid hormone, which is actually where all the cells of the body would bind to, or that T3 would bind to any cell of the body and create a response and making sure that that cell is actually working. So that's really, really important that is optimal. So reverse T3 can get produced if we have a lot of stress, inflammation in the body. And so we don't want to have high reverse T3 because it blocks the active thyroid hormone. So measuring that is really important. What we want as well by looking at all this is to see, well, how do we optimize this in case these are suboptimal? The conversion of T4 to T3 is facilitated by a mineral called selenium. So we do want to make sure that you have enough selenium in your system. You also want to make enough thyroid hormone. Thyroid hormone requires iodine. So often we don't have enough iodine from our diets, and so iodine is an important aspect to look at. And finally, zinc. Zinc is one of my favorite minerals. It's involved in many different processes in the body. It helps the thyroid conversion as well as production. Zinc is important for our immune system, for the production of digestive enzymes and stomach acid to digest our food better. It's important for skin, hair, nails. I mean, you name it. Zinc is part of so many things. So another common deficiency, unfortunately. So we would want to make sure those minerals are adequate so that you can make enough thyroid hormone. We also can look at the T3 to reverse T3 ratio here, and you want it to be greater than 0.2. If it's not, that means you're making too much reverse T3, and we would want to flush that out and correct that whole system. If you have antibodies to your thyroid, then most commonly we would look at diet and looking at a gluten-free diet, as gluten has been shown to interfere with that or kind of facilitate that antibody response to the thyroid, but there are other ways as well to balance that out. So long story short, if you really want to know what's going on with your thyroid, it's important to get the full thyroid panel done. You can ask your family doctor, absolutely, for this. I believe reverse T3 is not covered under OHIP, so you would have to pay for it out of pocket. But alternatively, as a naturopathic doctor, I can send you for Life Labs, and we can do the full thyroid panel, and we can make sure that everything is balanced. Thanks for watching.